Study published by Randolier et al. Earlier, maybe about 5 years back, and that study talked about it was an RCT which was federally funded, and it compared the standard treatment, that is giving clomiphene citrate followed by CCIUI for 3 cycles and HMG-IUI for 3 cycles, and then IVF, and other group getting randomized straight to being fast tracked to doing 3 cycles of IVF. And what this particular study said that, well, IVF definitely has a better success rate and the time to pregnancy is much lesser in patients of unexplained infertility. And this particular study followed those participants further. So of the 503 participants of FAST trial who participated, they were contacted by telephone calls, and almost they did about 10 telephone calls to them, and then they also a questionnaire was sent and all the data were collected. And what they found out, that majority of the couples did continue to try for pregnancy, and about 80.9% achieved pregnancy later, irrespective whether they had a live birth rate at the FAST trial or they failed in the FAST trial. Of the women who had one live birth successful in a FAST trial, they continued to try for the next pregnancy, and 79% of them conceived either with IVF naturally. But believe me, none of them conceived with IUI, and this is one point we need to go through, that in unexplained infertility, after a certain number of IUIs, there is no point pushing ahead with IUIs, and one needs to move ahead, because unexplained infertility means, well, I really don't know what's wrong with you, not there is nothing wrong with you. And what they found in this particular study was young women with normal body mass index is the one who had a better live birth and better time to pregnancy, and they succeeded further even after the trial was over. And they clearly say that this is one thing we need to convey our patient, that unexplained infertility is not a lifelong diagnosis. So should we say that just keep trying? Should we not label them or just allow them to keep them trying? I think it's better to label them also, because if you label them that you are suffering from an unexplained infertility, because this is a set of investigations we have done, it is beneficial, because once you diagnose them, they would say, well, I would like to enter treatment for unexplained infertility. And when they enter treatment actively, proactively, of treatment designed for unexplained infertility, obviously the time to pregnancy lessens and chance of pregnancy improves. And I think that's what matters.